It's gonna be good. It's gonna be great. It's gonna be better. I can't wait. Making my move. Live for the day. Sing like a bird. Fly like a plane. Come spill with me. Jenny D.
Hello, my beautiful people. It's me, Jenny D from Spill With Me, Jenny D podcast, a new episode this week. Today's episode is sponsored by St. Clair Health. We are joined by Dr. David Hepps at St. Clair Medical Group Urology. He is the first urologist in the greater Pittsburgh region to implant the BioProtect Balloon. I can't wait to hear about this. An innovative device that helps protect healthy tissue during radiation treatment for prostate cancer. Welcome, Dr. Hepps. It's also September is Prostate Cancer Awareness Month. It's time to shed some light on one of the most common cancers among men and to highlight the progress being made in early detection and treatment of the disease. So we are at the end of September, Dr. Hepps, but there's no time but any time to talk about the screenings of prostate cancer.
Yeah, thanks for having me, Jenny. I really appreciate it. Yeah, and prostate cancer is something that we treat all the time here at St. Clair. We have 5 urologists. Everybody treats prostate cancer, and we're very passionate about helping men and their families attack this problem. And we provide top-notch care to help families. And
So how long have you been here at St. Clair House?
So we've been here for about 7 years. We've been working here.
Okay.
Yeah. And it's been a good relationship.
Well, I mean, here's the thing, like for listeners who may not be familiar, can you explain prostate cancer and how common it is among men? Because, you know, a lot of times people don't understand, like, oh, you should get screenings, or we should be telling the men in our life, you should be getting a screening. So can you tell us a little bit about prostate cancer?
Yeah, sure. So maybe what we'll do is just start with a little bit of what the prostate is, and because it's kind of this like cloudy, nebulous thing, like, oh yeah, prostate, what the hell? Don't, drop the conversation. But yeah, so the prostate is a reproductive organ. It's a gland. It sits in the pelvis. Only men have prostates. Right. It's kind of underneath the pubic bone. Okay. So it sits between the bladder and the urethra. And the prostate sort of increases in size as we age. First off, it's really a reproductive organ that helps the sperm fertilize the egg. It produces fluid that helps the sperm fertilize the egg.
Okay.
So that's why we have it. And after we have kids, it only causes trouble. So it can
downhill from there.
Yes, it just causes trouble. So as we all get older in age, in our 40s, 50s, and beyond, the prostate will grow. And that's when you hear about prostate enlargement. And that's predominantly benign prostate, non-cancerous enlargement, right? But what can happen in some men is that certain cells can proliferate and be abnormal, and that's prostate cancer. And I feel like our role as urologists is to help identify and differentiate. Are we dealing with a benign problem, non-cancerous, or cancerous problem? And the problem with cancer, sometimes those cancers can spread to other areas and cause other trouble, pain, organ damage, whereas benign prostate enlargement doesn't cause that. And so we as urologists treat both and can help men figure out what's going on.
Right. And now, what are some of the warning signs of prostate cancer? Because that men may be aware of, like, how important is routine screening? Because, for instance, like, I have 2 boys. I mean, what age is it? Like, when do you tell someone? Because I know it's not on the first thing on their list. Like, oh, I think I'll go get my prostate exam.
Right. Hopefully it's not on the first thing on anybody's list. But yeah, for sure. So I think it can be somewhat controversial, but I try and make it easy and tell folks that around the age of 40, at least this is our philosophy in general, most urologists, you should get a baseline test.
Okay.
And that baseline test entails really a blood work test called a PSA. And so if you had if your brother, if your uncle, if your dad, we may start you at age of 40.
So family
history is important. If you're having some symptoms, maybe 45. And if you're doing fine and have no family history, maybe age 50. But my philosophy is it's a blood work test. It's not hard to get. Just get a baseline in your 40s. And based on that, we can decide, hey, is this kind of elevated? Should we watch it a little bit closer?
Right.
Is it normal? Oh, don't worry about it. Get another one in your when you're 50. So I think there's some guidelines. There's no rules. And you really have to individualize it to each person.
That's true. But there's no warning signs. Like, for instance, you wouldn't feel it or you wouldn't feel like...
So before I was into urology and during my training, the PSA wasn't available. So my old school professors would say, hey, before we had the PSA, men would come in and it would be already spread. So the problem, so once you develop symptoms, the problem is you're already kind of behind the 8 ball with prostate cancer.
No.
That being said, if you're having blood in the urine, if you're having significant urinary symptoms, meaning that you're struggling to pee, you're having pain, those are things you should get checked out.
Okay.
So predominantly, PSA will predict. I make the analogy. It's kind of like that earthquake Richter scale.
Right.
We were not going to feel a very low grade little minor earthquake, but the PSA, it'll measure it. But by the time that you're feeling something, you're already the Golden Gate Bridge
early,
fall down. So that
early detection. Just go for the blood work.
So that's an easy test. Get checked out. And we'll just go on from there.
Yes. Now, how does prostate cancer affect not just the patient, but also their loved ones?
So, yes, the prostate cancer can affect, we try and bring in the whole family when we talk about prostate cancer. Obviously, it's a relationship between the gentleman and the doc, but prostate cancer can affect sexual function. It can affect urinary function. So it can affect the relationship that man has, that couple has. And we try here at St. Clair to really work early on, if the patient wishes, with his family, with his wife, with his partner, to let them know what to expect. Right. So I think being open and honest and confronting those potential issues is essential. I
love that. It's St. Clair Health that, you guys, that you're all giving communication and you're really helping, the families, not just the patient, but, because a lot of people don't understand, what does this mean? What does this mean in the future? What kind of things do I need to do for this? So how has prostate cancer care advanced in recent years? And what excites you most about the treatments now available at St. Clair Health?
Sure. So we've been treating prostate cancer for a long time. And there's 4 urologists here that use different types of treatments ranging from laparoscopic robotic surgery to treat the appropriate gentleman. We also work with a radiation oncologist closely because radiation is a great option for the right patient. Right. And kind of circling back, in the diagnosis, when we diagnose prostate cancer, it's not guaranteed that you even need to treat this. Because a lot of men will have kind of dormant, latent prostate cancer. So we have a robust so-called active surveillance program where we may just monitor that, trying to avoid potential issues that are associated with treatment, like those sexual issues, those urinary issues. On the other hand, we don't want to ignore something. So we have high-tech options, minimally invasive options, like I said, ranging from robotic surgery to really forward-thinking options for gentlemen who choose radiation to try and optimize cancer outcomes, minimizing potential.
Dr. Hepps, when you were saying robotic, what did you mean by that?
So robotic surgery, there's a system called the Da Vinci robotic system. Okay. And so really it's a fancy term for a type of laparoscopic surgery. So when we do this type of surgery, the goal is to remove the prostate. Now, traditional surgery, you made an incision and went in, there were a higher rate of potential problems, complications such as sexual problems and urinary problems. And men stayed in the hospital for a while. With robotic surgery, we can go in with a few keyhole incisions, and the robot enables us to do not only remove the prostate, but reconstruct the bladder, urethra,
everything's functioning.
so they can optimize the function. So we have a couple of robots here at St. Clair that are.
And this is something new that is just happening?
It's been around for a while, but I think we do a lot of this type of surgery. Like I said, we have 4 sort of great urologists that do a lot of this type of surgery, and I think we do a really good job of this.
Oh, yes. So you are the first urologist in the greater Pittsburgh region to implant the BioProtect Balloon. Can you explain what device it is and how it works and what it means for prostate cancer patients' ongoing radiation treatment?
Yeah, so
I had to look that up when I saw that.
yeah. It's not something that's right on the front of your tongue there.
Yeah.
So the balloon system, it's really, we use this in collaboration with the radiation oncologist. So, for example, a gentleman comes in, he decides, we find that there's some significant prostate cancer. He decides, hey, I'm going to go move forward with radiation for prostate. I want the best treatment possible.
Right.
So the prostate and the rectum are very close, a couple of millimeters away.
Okay.
And the radiation oncologist is saying, well, I want to deliver radiation to the prostate without injuring that tissue, the rectal tissue. And if it's only a couple millimeters away, the worry is I'm applying radiation to the backside of the prostate. I don't want to, friendly fire and injure the rectum. So that space in there is very narrow. So what we can do as urologists is find a way to increase the space between the rectum and the prostate. And the concept is we place this device called a spacer.
Okay, spacer.
And there's different types of these spacers, but we found that this balloon system, we can surgically and very precisely place it into that space between the prostate and the rectum, and creating elevation of the prostate so that the radiation doctor can now deliver appropriate amount of radiation to the back of that prostate without injuring the adjacent tissues.
Wow, that's amazing.
Yeah, so it's pretty cool. I mean, it's kind of a nuanced thing, but I think in terms of optimizing cancer control and preserving patient outcomes with a minimal side effect, it can make a huge difference.
Yes. I mean, and this is brand new. Like, did this just come about?
Yeah, this is the clever bioengineers figured this out. And it's a really cool. No, it wasn't me. I wish I did. No, it wasn't me. But it's a really cool little system. And so we've done this in a number of patients, and guys have done really well. Really well.
So it's been around for, would you say, like a couple of years?
It's probably been around for a couple of years, but it's really the concept of creating that space has been around for a few years. But this technology has been available to give us a more consistent, precise placement to achieve, again, the best outcomes.
Right. Oh my goodness. That's so great. What has been the response from the patients, like have the benefits from this technology? What have you heard from them?
Yeah, I think the best response is that they really have minimal side effects.
Oh,
the goal is, because guys would come in and they say, I'm having a lot of symptoms sometimes after radiation, or I'm having some issues with this new device. Guys are really coming in, they get it placed, they go on, get their radiation, and they really have much less side effects and hopefully better outcomes. We're continuing to monitor this because it's new.
Well, let me ask, this might be a stupid question I'm asking you, but what happens with like the balloon, or does it dissolve, or does it,
Yeah, so the balloon, it's kind of cool, right? You think, where does it stay in there? I don't want that balloon in me.
Yeah.
So in any event, the balloon's made of the same material that an absorbable stitch is used.
Oh, okay.
And then we fill the balloon with sterile water. So everything absorbs within a few months.
Oh, wow.
So, yeah.
That's incredible. I know. I wasn't sure. I was like, I'm thinking,
Yeah.
imagining in your head, like, what does this look like?
Yeah. It's kind of weird and crazy at the same time, but it's, urology has been a good field in that we, especially here at St. Clair, I think are, again, forward thinking, that we're willing to adopt technologies. We don't want to be necessarily the first to use it, but if it's showing promise and we think it's a better option for our patients,
Right.
Hey, let's do it.
Yes.
So we're quick to pull the trigger in that sense.
I love it. You got a great team here. Facing cancer can feel overwhelming. And what advice do you give men and their families as they begin this journey?
Yeah, well, I think that one of the things we are good at is trying to work in a collaborative fashion. So my philosophy, hey, if you're going to do surgery or radiation, everybody hears about the rehab after surgeries
Right.
or whatever they do. My philosophy, hey, let's do prehab this getting ready for the surgery. So not only that means trying to get in better shape,
Oh, so weight
trying to
has
lose,
to do with
if you have that extra few pounds, it's going to be a springboard to going out and exercising.
Okay.
People are anxious, waiting, they're eating nervously and for good reason.
Right.
But taking care of yourself, stop smoking, lose weight, exercise. 3 low-hanging fruit. They say while you're waiting for treatment or we're monitoring this, that's what's going to be the biggest thing to move the needle in terms of your health. Because with prostate cancer, it's kind of tricky. We're treating you usually 5 years down the road. This isn't going to spread typically in a year or two. We're treating you for 5 years out. Yeah, it's a good point. Prostate cancer, we diagnose this in about 200,000 people a year.
Oh my gosh.
So a lot of these men, and it's the behind skin cancer, it's the leading cause of cancer diagnosis in men.
Oh, I did not think
So
that.
it's very common. And a lot of people think, it's not going to kill me. It's, I'm just going to live with it and it's not going to. So you have to balance the commonality of this with the fact that it's the second leading cause of cancer deaths in men. So it kills 30,000 men a year. So how do we determine who you really need to treat aggressively versus, hey, maybe we can just watch this?
Right.
So that's the art of the medicine, I guess,
right.
in trying to figure that out.
And the screenings. I mean, if you're not doing it, getting your screenings, then how would you even know where you are in the process?
Right. And so it's kind of a collaborative effort, letting not only the guy know what's going on, but also if we can incorporate his family, make sure he gets in good shape. Because if you're in lousy shape, you're going to I always tell guys, hey, you got to get your heart and lungs and your overall body in good shape, because I need you to live for at least 5 years before the prostate cancer gets you.
Right.
So I always do the comparison. If you're picking up the pennies on the train tracks, you don't see the train coming.
Right.
So trying to put it in perspective is sort of part of my role.
You don't want to give them that panic, like, you better, but you also want to tell them, hey, these are the steps you need to take in order to feel better.
That's how you approach life. You don't want to, perseverate on the little things. You got to see the big picture sometimes.
Right. It's so true. Now, I think we already sort of covered this, but how do patients balance treatment with maintaining the quality of life during and after prostate cancer? I was thinking about that too. Like, are they homebound or can they?
No. So in terms of, from a surgical component, guys are usually in the hospital overnight. Yeah, it's a recuperation over that next week or two, but most men are up and about that day of surgery. If not the next day, they're home and they come back. They do have this, guys get freaked out about this catheter, understandably, but that's essential for about a week. And after that, the biggest thing they battle is usually to deal with erectile dysfunction and some urinary issues. But most men will recuperate significant function. That's the thought. But we don't want to be silly and say every guy is going to be perfect. It is a change. So I think part of it is just being honest with the patient and the family and telling them what to expect.
Yes.
And
that's the best, medicine for you to, talk to the patient. Like, listen, here's the cards on the table, this is what you're going to go through and this is how we're going to help you. Yeah. That's what people want. I mean, you're the expert, anytime like a patient comes in, I'm sure they're just like, overwhelmed.
Yeah. Once you hear a cancer diagnosis, I've done this long enough to say all you hear is cancer and everything else is toast.
Yeah, you're like, I didn't hear anything that you said.
So, right. It's kind of a process. And luckily with prostate cancer, we can have that. We have a little bit more time to tease through it, tease through the options. Hey, go home, talk to your family, bring them back. Let's sit down and have a powwow so everybody's on the same page.
Yes, absolutely. What do you want patients and their loved ones to know about the care and the support available here at St. Clair Health?
Well, I think the key thing to know is that we have a great group of guys in the urology department. I really enjoy working with them. We each function independently, but we're all like brothers in the sense that, hey, I have something that doesn't look right, does appear. What do you think about this, gentleman? So we really can do that in a very comfortable way if necessary. We also have a good team in terms of there's something called pelvic floor physical therapy. And that's something that you guys have probably, that's a pretty cool thing that during my training is very powerful and gives patients something to do. And so we work in collaboration with them. We work in collaboration with the oncology teams, both radiation and medical oncology.
Right.
So I found that working together really enhances the overall experience. And my goal is that treatment of prostate cancer, if it needs treated, is just a bump in the road.
Right.
That you go on with your life. This is a little bump. This doesn't define you. This is something that you're going to deal with. And then we just kind of move on and go from there.
I love the fact that, St. Clair Health, I mean, you come here for anything. And instead of running to all these different doctors and hospitals, you have it all here. And everybody's communicating, everybody's talking. I've had on, a number of doctors, teaching hospital. And, you're just really, making patients feel at ease that they're here and they've got the expert care, right?
Yeah, I think in general, we're kind of just regular guys. Maybe we have a little training in our specialties, but we understand I don't want to sit in a doctor's office more than I have to.
Right.
So if we can make things as efficient as possible for you and streamline it, we'll try and do it. And our goal is to always improve upon that.
Right. Now, is there anything else that we didn't talk about that maybe, I know we were talking about testosterone and some like hormone replacement and UTIs. Is there anything else you'd like to tell the listeners and viewers today?
Yeah, I think number one, make sure you get checked out.
Right.
I think that there are a couple of, again, I use the analogy, low-hanging fruit. There are three main cancers that we can screen for easily in men. Number one, lung cancer, the number one killer. So don't smoke. And if you do...
Is that really the number one killer?
That's the number one killer of men across the board.
Yes.
So what can you do?
Right.
Stop smoking or don't start smoking. And if you are a smoker, there's things you can do like get screened, get a CT scan, talk with your PCP early screening.
Right.
Number two is prostate cancer. So get your PSA, get checked out. It's an easy blood work test, right? And number three is colon cancer. So get your colonoscopy.
Right.
Those are three easy low-hanging fruit. They're not, the colonoscopy is kind of a pain in the ass, but really, but
yeah,
just get checked out and that's easy.
It's so fast. It's really I've already had one. So to me, it wasn't that bad.
Yeah, it's easy.
I think everybody makes it feel like it's going to be worse than it is.
It's not. They do it so well. These guys are such professionals who do it, the GI and colorectal team, that, don't even think twice about it.
Right. And I think that's the one thing, too, is a lot of people don't know, like, do I go to my primary care doctor and then they give me a script, or can I just call the hospital? Like, what would they do for the steps of just getting the blood work?
So you can get the blood work for the prostate. You can just ask your primary care.
Okay.
And he can do a screening PSA. And if something's goofy or doesn't know how to interpret it, he'll say, hey, maybe you should go see your urologist.
Okay.
If you prefer to talk with a urologist directly, you can call up St. Clair and they'll direct you.
Right.
So, but you can do it easily. You just piggyback it onto your other blood work if your primary care hasn't been doing it already.
Right.
Yeah.
That's so true.
Yeah.
So, if there's anything else. I'm
a big advocate of hormone replacement in the right man.
Right.
So I make the analogy also that oftentimes with breast cancer, it can be estrogen sensitive, hormone sensitive.
Right.
So one of the foundations that back in the early 1900s, they found out is that prostate cancer is also hormone sensitive.
Oh, really?
It's sensitive to testosterone. So in those gentlemen who have prostate cancer that's spread, one of the primary treatments is to take away their testosterone, and that prostate cancer shrinks.
Wow.
So in men who want to go on testosterone replacement or have questions, you need to make sure there's no hidden prostate cancer there. Because the theory is not that testosterone causes prostate cancer, but if you have some prostate cancer that's harboring in the prostate and you start to supplement your testosterone, you want to know if that's going to proliferate or what's going to go on. So although I treat many men for low testosterone with hormonal therapy, one of the foundational things are, hey, we have to check your PSA, do a prostate exam before we start you on this, make sure there's nothing hidden going on there before we start you on testosterone replacement.
So instead, I know there's a lot of things available now, with the hormone replacement. So don't just walk into a place, get your testosterone without going through the blood work.
Most places are pretty legitimate, but I think if I'm recommending to my family member, I say, you need to check out a doc that you trust and appreciate. Just don't go make it a transactional environment.
Right.
Because the worry is something's going to get missed and you're going to be in trouble. Right. So, yeah, there's plenty of good urologists, endocrinologists, or even primary cares who you can trust and may talk to you about, hey, is testosterone replacement right for me? Is it not? And that's a whole nother conversation.
Right.
But in the right man, that can be pretty transformative and really improve their quality of life, their overall health, their sexual function, many different things.
Right. Well, I thank you so much for, all this information. Thank you again for joining us today and for sharing your expertise, Dr. Hepps. Your commitment to advancing prostate cancer treatment is giving patients new options and new hope. For anyone listening, if your loved one are due for prostate cancer screening, or if you're seeking expert care for diagnosis, the St. Clair Health team is here to help. Taking their first step towards screening and early detection could make all the difference. To learn more and schedule an appointment with Dr. Hepps or another St. Clair Medical Group urologist, provider, call 412-942-4100. Thanks again for listening to Spill with me, Jenny D.
Thanks, Jenny.
Thanks for being on.
Appreciate it.
Take care.
Come spill